and Pamela Hurd, who is also a professor at Georgetown. And they very kindly agreed to come and discuss with us their new book. And here it is, Administrative Burden, Policymaking by Other Means. And what I'd like to do is just have them introduce briefly, first, why they wrote the book. Second, a couple of just really memorable examples about what their argument tells us. And then perhaps we might even get to, apart from being two extraordinary scholars, they are also partners, co-parents, married. How do you write a book and stay together? Anyway, minority interest for some. But let's start in with this terrific work, which is really aimed at thinking about how the public service can deliver better. So can I start? Who would like to kick off? Because what I'd like to start with is why this book. Pamela, do you want to kick off?
Sure, yeah. Part of the reason we decided to write this book is that Don and I, well, yes, we are married. We actually have, since graduate school, done really different kinds of work. My work really focused on sort of social welfare policy and inequality. I also do a lot of work in health. Whereas Don had really studied essentially bureaucracies, performance management bureaucracies. So I was really interested in how kind of policy designs affected inequality. So whether you had big universal programs versus targeted programs, what's more effective at reducing poverty and inequality, those kinds of questions. Where Don was more focused on kind of the nuances of how bureaucracies function. He can speak for himself about that. But the overlap for us basically was this sort of intersected both topics, which in the sense that it's a book that actually is really focused on bureaucracy in a way. It's really focused on how these kind of interactions that people have with bureaucracies, with government bureaucracies in particular, can frustrate them, can make them feel worse about themselves sometimes, and can ultimately kind of reduce the effectiveness of policies. And so what was interesting about it for me was thinking about not how like the design of a policy influenced the way it would impact inequality and poverty reduction and all of those things, but how the actual kind of implementation of that policy, how the actual kind of interactions that people had with that program affected the ability of that policy to do its job. And so on a very personal note, one example that came about just a few years before we started actually working on the topic together was our oldest daughter has a disability. And for those of you in the UK, you wouldn't be familiar with health insurance like this, but in the US, access to health insurance is not universal. And they have these policies at the state level in the US that kind of help offset or defray some of the costs associated with raising a kid with disability via the Medicaid program. You don't have to be sort of have a low enough income. You just simply have to have, let's say, a child with a disability. So I taught social welfare policy for years. I knew about these programs, right? So soon after our daughter was diagnosed, I call up the state of Wisconsin and sort of say, look, I want to apply for, it's called the Katie Beckett program. I want to apply for Katie Beckett. So they asked me a few questions, and then they proceed to tell me that my daughter wouldn't be eligible. Well, I knew for a fact she'd be eligible. But what I realized was, oh, this is what it's going to be like. And I'd read about this, right? I'd read about these kind of interactions for years, the kind of insurmountable obstacles that people would often face, even when they were eligible for these programs. And it really hit me then as someone who, right, this is someone who knew a lot about this program. This was someone who knew well enough if I did the work, I could get around the program. But I understood at that moment how much work that was going to be. And it really, I'll be honest here, like I waited to apply for the program for a really long time just because I couldn't manage it. So it was a real eye-opener for me about the kinds of consequences that those kind of essentially administrative burdens can mean for people in their everyday lives.
And Don, can I just ask you, so administrative burden policy making by other means makes it sound as though you think that governments are deviously trying to deprive people of the benefits that they should be entitled to. Is that what's going on?
I think in some cases it is. As Pam said, my background's in public administration, and we've always studied red tape in public administration, but the explanations for why red tape occurred tended to be fairly benign. There might be some rule that was on the books for 150 years that no one really thought to get rid of, or politicians didn't really understand the consequences of the rules that they were having on citizens. What we saw, and part of what motivated us to write the book, is there are also policy areas where that was clearly not the case, where politicians understood that instituting certain types of new rules or procedures made it more difficult for people to access services, and that was the point. And in some ways, this was a form of policy making that was a little bit easier because it was less visible. So let's say you required people to add more documentation or more evidence that they qualified for a program on the form. That's not the sort of thing that grabs headlines. It's not the sort of thing that's publicly debated much. But it does have an effect on whether people participate in programs. So by using these sorts of tools, by making it harder to learn about programs, by increasing the compliance costs of trying to sign up for a program, by making it more psychologically painful to engage with the state, you can actually reduce participation. And part of, because our interests tend to be in the area of social policy, I also study voting, across those policy areas, we could point to example after example where politicians were adopting these rules on fairly flimsy excuses, but with the intended effects of reducing participation for certain groups in society.
So an intent to deprive people of their entitlements. Pam, are there any cases in the research you've done which tell us about bureaucrats doing the opposite, where politicians are intending to deprive people of what they think or should be eligible for, but where the work of the public servants actually restores to people what they need?
Actually, there's a really kind of interesting historical example in the U.S. So Social Security, which is the public old age pension system in the U.S., is this universal program. When it was implemented, those bureaucrats were incredibly careful. The people who implemented the policy basically were super careful about training the kinds of thousands of people who would implement the program and interact with beneficiaries to treat people really well. The logic was you treat people like they've earned these benefits. They're full citizens, they've earned these benefits. And there were all kinds of ways, right from 1939 up to today, where you really see how that influences how people who interact with the Social Security system kind of have these really positive experiences. Enough so that this was in the 1960s. So they have Social Security field offices. There's thousands of them all over the U.S. and they're set up to help people enroll in the Social Security program. And in the 1960s in the U.S., when they implemented the Medicare program, which is our universal program for older adults for health insurance, at the time they were actually simultaneously trying to desegregate Southern hospitals, right? So blacks and whites were segregated in hospitals. And one of the rules with Medicare was you couldn't do that or you weren't going to get the money. And it was this huge infusion of cash into the healthcare system in the US. So there was no way these Southern hospitals would survive if they didn't desegregate. So most of them just did it really quickly, actually. But there was a small subset, about 1% of them in the Deep South, that didn't. And they were tricky about how they did it. So if a compliance officer came to make sure that they were actually desegregated, they would, before they came, they would like move people around, you know what I mean, within the hospital, for example. They'd move people around so that blacks and whites weren't segregated, say, within the hospital. There are all these ways of circumnavigating this. So everyone knew this was going on, but they couldn't figure out how to stop it. Well, they got the local field offices involved, the local Social Security field offices involved, the staff in those offices. And the issue was the staff in those offices were Southerners. They knew exactly how this worked. And so because they knew how it worked, because they were members of this community, even though the community as a whole was frankly still pretty racist, these field offices had been trained to think about people differently. And so as a consequence, they used those field offices essentially to monitor and ultimately desegregate those hospitals. They knew the tricks of the trade. They figured out how to monitor them in ways so that they couldn't pull these sort of shenanigans anymore. So that's sort of one kind of interesting historical example in the US. And there's these great studies that really actually show the consequence of that, which were these, within a matter of 6 months, actually huge declines in mortality among blacks in the South once they actually did desegregate those hospitals, because they gave people access to health care that they didn't have access to before.
Don, how do we overcome it? And to what extent are there bureaucratic solutions, and to what extent are there political solutions? And I guess for us, do you have a little checklist that you use in your head after this research to say, is this designed to deprive people of using it or not?
Yeah, so I think there's some of these choices are made at the political level. So rules are passed in policymaking, and some of them occur in the implementation process. From the citizen's perspective, the checklist, and there is actually a checklist in the final chapter of the book that sort of goes through how do you assess whether a program is burdensome or not. You start by asking, what are the learning costs? So how hard is it to find out about this program? Whether you qualify for something, what you would get about it. If you don't speak the language of a country, is it possible for you to learn information? Is it accessible online? Right? Then there are the compliance costs. So how many forms do you have to fill out? How much documentation do you have to provide? How frequently do you have to recertify your status? How much money do you have to spend maybe to hire a lawyer or an advocate to help you? And then there are the psychological costs. So do people feel a sense of stigma when they engage with your program? Do they feel like they've lost some sense of autonomy? Is it a stressful experience for them? A lot of these things are not incredibly complicated once you start writing down that checklist, but we haven't trained public administrators to think in that way. And so when you have students in a school like here, we do a good job, I think, of thinking about cost-benefit analysis for things like regulation of private businesses, but we don't do quite as good a job at helping them think about how do you balance burdens and benefits when you're dealing with an individual citizen. Right? How do you think about ways to minimize burdens even in a way that actually helps citizens but doesn't damage other values that you care about?
I'm going to come to the room, but can I just say you mentioned the stigma and stress. So in your research, how did you measure that?
So it varies. So a lot of this is a classic social science answer, right? You know, it varies, depends on the question. So I can give you a variety of answers, right? So one way of looking at this is asking people who are eligible for programs but don't participate why you didn't participate, and they will frequently articulate they don't want to feel dependent, they feel like welfare is for other people, it's not for them, there's something shameful about that process. And so they'll articulate that idea of shame or stigma in their responses. There are anecdotal examples, and if you don't mind, I'm going to read one of these. So this is one of the reasons why we wrote the book, was partly because we were interested in people's experiences. And I'm going to read the experience of someone who was in Wisconsin. She was a 85-year-old woman who lived in Wisconsin her entire life. Wisconsin passed the voter ID law. She did not have an ID because she didn't have a birth certificate when she was born. And there was a spelling error on the registration information the physician gave to her. So she's 85, she goes to her local Department of Motor Vehicles, but she doesn't have ID. And she's describing here her experience. How do I know you're not an illegal alien? A DMV employer asked her. Well, that really hurt. I've lived in the same house for 85 years. I've served on the village board for 18 years. And then they told me I wasn't going to be allowed to vote. I've always voted. I've been registered to vote since I was 21. And I've never missed a presidential election. I left the DMV and thought, it just isn't right. I felt so downtrodden. It felt like I wasn't as good as anyone else. So when you talk to people, when you take the time talk to people who go through some of these experiences, just hearing how they account for those experiences does make you think, wow, there probably is some negative psychological impact going on from these.
And when we stand back, is the problem getting bigger or smaller? Like, are politicians using this more as a way to kind of excavate welfare systems or entitlements? Or, you know, where are we on the curve with administrative burdens?
Yeah, in the US, for sure, there's some evidence, or we felt like as we were writing the book, that conservatives are using this more aggressively as a strategy to get policy change. And not just in social welfare policies. So Don talked about the example of voting rights. That's something that has ramped up over the past 15 years or so in terms of making it harder for people to vote, which is more advantageous for Republicans than Democrats. Abortion, reproductive health policy in the US is another example where, you know, people have a legal right to abortion, but over the past 15 to 20 years, they've just made it really hard for people to access that right. A range of different things by putting all of these rules on the outpatient healthcare providers who provide abortions, which effectively just make it too expensive for them to provide an abortion with no good reason. Like, they don't improve women's health. It's just, there are actual quotes where they're pretty vocal about why they're doing this. Also things like waiting periods, making people wait 2 or 3 days before they can actually get the abortion. Those sorts of things, basically. So across those domains, across health policy in the U.S., the Republicans were pretty clear that they were intent on dismantling Obamacare. But they were unable to do that successfully legislatively. So instead, they've increased learning and compliance costs in the program. So for example, this is a program, to be clear about this, the Obamacare and the American Healthcare Affordable Care Act are the same thing. The ACA, Obamacare, they're the same thing. If you ask your typical American, though, somewhere in polling, about 40% of people don't realize they're the same thing. So there's like huge learning costs in terms of people actually understanding what the program is, whether they might benefit or not. And they basically reduced a lot of spending on outreach. They reduced the enrollment period. They put all these hurdles in people's way that has actively reduced participation in the program. So across a range of different policy areas, especially over the past 15 to 20 years, yeah, it seems like a strategy that conservatives are employing when they can't get major rulings like Roe v. Wade, which protects abortion, overruled, or major legislative change.
And so partly the conditions that Pam describes in the United States are intense polarization, but also policy gridlock. And under those conditions, it makes more sense to use these sort of subterranean mechanisms to make policy when you can't make policy through traditional legislative processes.
Mm-hmm. I mean, there was in the 1980s a philosophical view that if you made it really hard to get these benefits, then only the neediest would really push hard enough to get them. And the story you tell is that actually the neediest probably won't get them, the opportunists will. So it's sort of and then you get into what in Britain is a bit of a Daily Mail cycle, where the only people that can access the benefits, are living in some kind of mansion, and the people who really need them are not opportunistic or have the time and resources and information to get them. Is that what your evidence shows? Or?
Well, the sort of the classic economic model of this is that the wealthier you are, the more you value your time, the less likely you are to deal with ordeals of queuing in line or filling out forms, right? And so that's the theory of ordeal mechanisms from economics. The reality is it's that human capital matters a lot. So people's educational level, people's perseverance, so personal skills, people's ability to manage bureaucracy, those sorts of skills are not related to wealth. If anything, people who have more financial resources are more likely to have human capital. But in practice, empirically, when we look at variation and take-up of programs and look at the people who tend to do best when compliance burdens are highest, they tend to be people with higher levels of human capital within that particular group. And so the result is, as you sort of suggest, Nari, the people who might need a program the most might be less able to manage the administrative burdens inherent in getting access to the program. And so in this way, even programs that are targeted towards helping the poor can end up having these distributive effects where they actually facilitate higher inequality within groups, because the people who need extra help, maybe in completing forms, just don't have the capacity to get that help.
I think it's important to be clear, though. So at least in the U.S., and this is not uncommon, I think, in other countries, at least in the U.S., that somewhere between, across social welfare programs, somewhere between 20 to 50% of people who are eligible for those programs do not get benefits. So the government tracks fraud and abuse, which fraud and abuse is a bit misleading because oftentimes it's people just making mistakes. Like they don't realize they weren't allowed to claim this child or that child for certain benefits, for example. But the far bigger problem is, so there's some documentation of fraud and abuse in these programs, but it is magnitude smaller than the fraction of people who are not getting benefits who should. And we keep close track of the fraud and abuse, but there isn't sort of a performance mandate, for example, which we point out in the book, about why is it that we have all these people who are eligible and clearly need these benefits who aren't getting them. It's a bigger problem, clearly, statistically.
And so one sort of policy solution to that sort of problem is to look at models like auto-enrolling people who appear to be eligible based on administrative data. So rather than requiring them to fill out all the forms and opt into a program, to change the structure of choice so that by default they're in the program, and then if they actually don't want the benefits, they can opt out.
Great. Well, look, that gives you a flavor and a taste of the research that Pam and Don have been engaged in. So let me come to your questions. Yeah? Thoughts, questions?
Thank you very much. It was a thought-provoking presentation. My question is it because social benefits of this kind are not being treated in a multidisciplinary way, that most of them are economists, and there is excessive evidence determinism, like policy should be based on evidence, and in a way things are being presumed from the vantage point of economics, while this kind of benefit should have also been seen by specialists in public administration, because for example, if a certain student hangs himself on the cliff of his own room, if you ask for a lawyer, he will come up with his own explanation. If you ask a sociologist, he will ask from where the society where this guy has come from. But if you blend the two, and you will have a systemic explanation of what happened. And the same holds true in public administration. Because most of those who are involved in this kind of programs are economists, and
so you're saying, is it a design failure?
Yeah,
or is it deliberately designed?
I believe there is a problem in knowledge production. There is academic imperialism. Like economics is too much into this, and it focuses on evidence and relegates other explanations of the same fact.
Thank you.
I think there is an important story to tell here about what's the role of evidence in government, right? And what does it mean to be evidence-based when we talk about these programs? And the parallel story I would tell is if you look at the rise of cost-benefit analysis in the 1960s, which was this really esoteric economic technique that became adopted by governments around the world in the 1980s. If you passed any regulation on private businesses by the 1980s, you had to demonstrate that the benefits exceeded the cost at the federal government level. And so that was a mechanism by which people who are economists, but people from other backgrounds, were forced to talk about what is the evidence here? What are the pros and cons for this policy change? And we don't have the same sort of mechanism in place to have the conversations about the burdens that we impose on citizens. Instead, the closest thing that we have is we have estimates from something called the Paperwork Reduction Act in the United States of how long does it take people to fill out forms? And that's it. That doesn't constrain whether some sort of new rule goes in place. It's just, it takes 15 minutes. It has no real impact. And so I think as much as your point about having multidisciplinary perspectives on evidence is important, you also need to have mechanisms or forums where you can bring those perspectives together to actually force a discussion about whether these burdens are worth it. And in some cases they are, or whether they're not justified by the cost that they create.
Great. Yeah.
We're also really interested in if people have their own stories of administrative burdens, because usually people do.
Thanks so much for being here.
Yeah, it's working.
It's working.
I started my career working in the district office of a U.S. senator, and something that was striking to me was how, regardless of whether or not this is part of the congressional or the constitutionally mandated purview, district offices spend the majority of their time helping people navigate their government benefits.
Yeah.
And short of writing policies that are more easily accessible, who should be filling those gaps? Do you think that it is sort of a good role for elected officials to be stepping in and supporting their constituents in that way, or do nonprofits play a role in this? And do you have an example of a system that actually works pretty well in this regard?
So I think one of the ways to step back and think about it from a design perspective is any policy, even the most universal and inclusive, like involve burdens. Like Social Security, for example, right? You're tracking people's entire lifetime earnings. That's not actually a straightforward thing to do. And then there's all these rules about eligibility, which are based on quarters of earnings. It's actually sort of complicated, but it's easy from a beneficiary perspective, right? And it's easy from a beneficiary perspective because the government has taken on all the burden of figuring that out. Government keeps track of the earnings. They negotiate with the employer. They figure out the quarters. They set up thousands of field offices around the country that make that interaction easier. So I think, one, it's really important to understand that no policy exists without burdens. The issue is sort of how they're distributed. So one answer is a program like Social Security that's just that was well implemented and well designed. I'm sure you got some phone calls about Social Security benefits, particularly around disability, which is a different category than the retirement. And it involves its whole another level of administrative burdens. But if you compare Social Security and retirement to something like SNAP, it's just a whole different world. And so part of the challenge in the US is it just completely depends on where you live. So in some states, there'll be, actually Wisconsin was this way, had this great network of sort of nonprofits who worked really closely with government agencies that kind of helped navigate that process for people. Other states like Texas, maybe, Arkansas, not so great. There aren't that many places for people to reach out to get help with. So it's hard to give you a single answer, in part because particularly in the US, the sort of federalist nature of social welfare policy makes it super complicated at the state level. But I think the big picture point is where are those just, all policies have burdens. It's just sort of who's taking them on. And we have a lot of really good mechanisms to figure out how to make the state do it. So I'll give you a very specific example of a recent one. Maryland was noticing that they had all these people who weren't enrolling in Medicaid and who weren't enrolling for the premium subsidies for Obamacare. So what they've decided to do is on the tax form in Maryland, there's a box you check now to say I don't have health insurance and I want health insurance. And then they automatically take your tax data and figure out if you're eligible for Medicaid, they just enroll you. They do automatic enrollment. And if you're eligible for the income subsidies, they contact you and try to help you enroll in the ACA. So with every policy, there's a different way to talk about how you might do this. But those would be a couple examples.
Pamela, could you pass the microphone back to...
I once had someone suggest that politicians made programs complicated enough so they could claim credit when they solve the problems and fix it. I don't think that's actually true, but...
You did constituent services? Is that what you were doing?
When I first started.
Yeah.
Great. So first, thanks for writing That's like my favorite book on all of this of the last
Oh,
5 years.
lovely.
Thank you very much.
This is phenomenal. I have a question about sort of the political calculus of the Democrats or the left in the United States in agreeing to this. So some people have argued that one of the reasons that we've seen this increase in administrative burdens is that for the Democratic Party, the only way to get increases in government spending passed is to agree with Republicans that they will pass increases in spending if those increases are attached to extraordinarily burdensome procedures. So was this a political mistake by the Democrats, or was really this their sort of only strategic route to getting these increases if they were attached to these sort of conditions that would mitigate the magnitude of the increase?
So that sort of there's this classic theory from political science by Terry Moe about the design of bureaucracies, where you have these warring parties agree to compromises so that anytime you build something new, there's a part of the compromise is you also make it dysfunctional, right? And I think there's some truth to that, but I think it's also the case we see examples in the book where the layering on of burdens comes in the aftermath of the creation of these programs. And so what Pam talked about with the Affordable Care Act, which is where it, by all means, an incredibly complicated piece of legislation that was quite onerous to implement. And so those compromises were built into the cake because, this is how we do healthcare in America, and we're not going to do it any other way. But then at later years, you see the Trump administration decide to withdraw money from outreach and advertisements, to withdraw actual help in the form of funding navigators who would help you fill out the forms. And so that occurred not because of a compromise pattern, but because of this later stage point where they just had more political power. Wasn't enough to repeal the act, but it was enough to screw up with how the law was working in practice.
I mean, I think there's probably a point about, too, the degree to which the compromise is not as simply around, or maybe even less around procedures than around the narrowness of eligibility, right? And so the narrower you make eligibility, on some level, the more burden you add. But there's still ways to navigate around that at the kind of bureaucratic level. Like, the example I gave you just in Maryland, there's tons of ways, even with relatively restrictive policies, to use tax data, for example, to kind of reduce some of those burdens. There are areas that do just make it harder. For example, asset limits. It's hard to get around that, other than to sort of say, we're gonna sort of take at face value what people tell us about their assets.
I do think, though, that I just want to concede your greater point. Progressives have really struggled to come up with a political language to describe these administrative burdens. And I think the only examples we found from the book where they did a good job is in abortion rights and in voting rights. And that it was still a response to what Republicans put out. But those are not, coincidentally, the only areas where administrative burdens moved from being this thing that was not really debated publicly to being something that was an intensely political issue. So people would go on the record on their stances on these things. They would have to vote about minute detail like the width of hospital corridors for these abortion providers, or specific rules about how you register to vote. And so I think there's a lot of power in finding a language that communicates to people that these burdens really are onerous and intrusive and damaging. But progressives are figuring out how to create that language.
Did you have a thought on that? No. Great. Next question. Yeah.
Great. So I've learned a lot from the book and really enjoyed it, and appreciate.
I promise we didn't plant these people in
No,
the
I was so excited to see that you were going to be here. And I appreciate that you've been putting this issue on the agenda so well. So I just had a question about if you were a well-intentioned policymaker trying to address these problems. So it seems like a first thought you might think is new technologies would make it easier to address these burdens. But then I was really struck by your discussion of Social Security in two ways. One is that you emphasize, I take it that the field officers were really important in these, and so that they played a large role, and that's not a technological solution. But also that Social Security did involve what we might think of today as like auto-enrollment, and they tracked all the data for people. So then I wondered today if both of you could just speak to what you do see as the potential advantages of a more technological solution, and also what you might see as some of the more persistent shortfalls where it's not going to be a full solution.
Yeah, I mean, technology is sort of a double-edged sword. So on the whole, I think we have tons of examples throughout the book whereby improvements in technology can dramatically reduce administrative burdens. You know, at a base level, the degree to which we can kind of, at an administrative level, at the federal and state level, track people's earnings. And that's a major determinant of a lot of different social welfare policies or income guidelines. As I mentioned, it's a lot trickier if you're talking about assets, like tracking assets, except via the tax system still. I mean, it's not wholly impossible, and there are ways to do it via the tax system. So there are ways, yes, technology. And to be clear, the Social Security example, at the time, what they did was extraordinarily innovative at the technological level. So bureaucrats in Europe who had implemented these public pension systems decades prior to the US basically told the US it was hopeless, like that there was no way they could do it because the US was just too big, like geographically, population-wise, like how are you going to actually do this? So at the time they were actually sort of the height of technology in terms of how they figured out to track earnings. The downside to technology, and I'll go back to Social Security as an example, is it can actually be an excuse not to employ these sort of more basic outreach efforts which involve interacting with someone. So in fact, Social Security Administrative Services has seen big cuts in its budget over the past 10 years, even as the numbers of people entering the program has grown quite a bit because of the aging population. And the excuse has been, oh, people can just access stuff online. Like that's the way they'll do it online, and we don't really need these field offices. And in practice, that just doesn't work very well especially for older adults. Only about 50 to 60% of older adults are actually online at all. This will change with cohort replacement. But then you have like disability, you have poverty issues, access to the technology, all of that stuff. So it can be a double-edged sword in that way. And there's also, I think, a lot of concerns from privacy people about the government misusing data, right? So I think it's important to think about technology as just a mechanism. It can be used for good or evil, like Google says, right?
There are some examples where, and I think this is also one of these debates that's fulminating on the left in America about what is the role of algorithms, what is the role of technology in governing, whether algorithms are sort of inherently bad things. And you can certainly find examples of where that's true, right? And so, for example, Texas was using algorithms and data to try and identify people that it believed was above the income level to qualify for Medicaid. They were getting information from credit rating agencies. And there were a lot of errors in the algorithm. Within a year, half the people who were kicked off using that were back on the program, which suggested a high degree of error in the program. Right? You can also find examples of where information technology systems constrain the ability of bureaucrats to help people. Right? And so Virginia Eubank's Automating Inequality, her book writes quite a bit about that. On the other side, there's huge potential gains from thinking about how to use administrative data to make things easier for people. And so it has this, it's like Pam says, it's a tool, right? So that when, for example, Alabama rolled out its work requirements, the only way you could report whether you engaged in work or not was online. And this is for a population of Medicaid recipients, 30 to 40% of whom are not technologically literate, do not have access to a smartphone or a computer, And so you're automatically excluding them from the process when you're using technology as a barrier like that. On the other hand, if you use technology to auto-enroll people by using administrative data, by matching the information that the state has with the people's needs, it has this really strong potential to make a difference. And I think one model for this is Estonia, which has this very simple principle that they call the once-only principle, which is that you give your information to government once, and then you shouldn't have to do it again. After that, government has that information, and it should be able to track you through every citizen-state interaction. Of course, this is where the privacy issues come up, but it's a good starting principle. That, you know, one of the things we all get irritated about is, I have to fill out the same form 3 times in one go. Can you imagine being in a place where you basically just give the information once and never have to do it again?
Next question. Further ones. What was the, yeah.
Hi, I'm Paul. Thanks for the discussion. I haven't read the book. Just to circle back on the notion of burdens and benefits for citizens, and that kind of, I'm just sort of want to push a little further on that kind of construct as sort of like a parallel to cost-benefit analysis, and ask you, is there thinking that's sort of really developing in that space, and what are the assumptions about citizens' time or how to value people's time in that process? Is there any developments and thinking about that that's feeding into the design of delivery?
Not in the systematic way that we see with cost-benefit analysis. So, you know, if you're not familiar with cost-benefit analysis, economists spend a lot of time at debating about the value of a life, right, or other measures of what constitutes a cost or a benefit. And we haven't seen that sort of systematic attention arising yet when it comes to administrative burdens. And so, in fact, part of the goal of the book was just to lay out, here are the categories you should use when you're trying to think about what makes citizen-state interactions more or less onerous. So I don't think we're there yet in terms of having very specific measures of how you rate these benefits or not. Much of what we're trying to argue is just at least recognize that some of the burdens that you are putting on citizens are maybe more onerous than you actually intend, and maybe having a bigger effect than you intend.
I do think this is one of the areas where progressives actually have, just to be a bit harsher, have sort of dropped the ball. Like that even in really liberal places, people don't acknowledge the degree to which these kind of burdens really negatively impact the way that people view government, the way that people view the potential of government to help them. So like there's an example from the book about someone, right, New York State. What's more liberal than New York? New York City, no less, right? Most liberal place in the world, or well, in the US, which is all relative, right? So this, so this is a story, or an excerpt we had in the book. Dana Nieder, a New Yorker from New York City, was attempting to recertify a disability parking permit for her permanently disabled daughter. And she was required to complete multiple applications, provide paperwork from her daughter's physician, and see a city physician. Then the city sought additional medical documentation, including a CT scan of her daughter's brain, chromosomal labs, a neurology report, a psychological evaluation, school documentation of her daughter's disability, and details of her daughter's orthotics. After jumping through these hoops, she received the permit only to realize it would be valid for just 8 months. She explained her frustration. Let me prove to you how different my daughter is and how many special needs she has and how it's permanent. It's permanent, and why must I keep telling you that she can't walk for long and her balance isn't great and everything is more work for her and everything is more work for me and she gets so tired and I get so tired. I'm so tired, right? And these are people who are inclined to be so sympathetic to government. But if you have those kind of interactions, even among sort of progressives, even people who believe in government, I just, it really undermines people's sense of what government can do. And historically, that was one of the most wonderful things about spending the time kind of looking at Social Security, because they really understood that when they built the Social Security system. There's all these excerpts from the people who designed the system really saying, like, we knew it was so important that people had good interactions. The program was under a lot of political threat at the time, and they were super clear that they had to train those thousands of people who were going to interact with beneficiaries to be respectful, to try to make it as easy as possible, that these were citizens who deserved to be treated well. So I think we have still a lot to kind of learn from that, and progressives really need to take that more seriously.
Can I ask you each what most surprised you in the research? So you obviously came to this with some sense of administrative burden, each of you, from your research. But could you just give us one thing, each of you, that actually surprised you, that you found out and thought, wow, I didn't realize that, or did the problem turn out to be larger or smaller or different in some way, or the solutions?
So I think what surprised me was it disrupted this notion I had in my head of government as a progressive, and I don't mean this ideologically, but just progressive over time, gradually getting better over time at what it did. I mean, so I study bureaucracies, and generally I found bureaucracies are slow-moving, but when you give them a task, they gradually get better at it. And so I've always had in my head this idea that, you know, over time, government will generally get better. And what was interesting is, especially when we use the historical cases, seeing these echoes of design dysfunction that had been in place in government a long time ago, maybe being worked on and reduced, but then reappearing again. And so the chapter on voting goes back to the Reconstruction era, where we looked at very deliberate and overtly racist policies to make it harder for people to vote, that policymakers in the southern United States kept adjusting depending on what the federal law was, or they delegated more discretion to bureaucrats when they couldn't pass overtly racist laws. And then in the mid-20th century, we largely eliminated the vestiges of that era, only at the start of the 21st century to welcome back many aspects of using burdens to make it harder for people to do their most basic political action, voting. Right. That surprised me in some sense. It made me think government is capable of just repeating the same mistakes again and again over time, except that for some people they're not mistakes.
Yeah, I think this is going to sound bad, particularly because I'm married to a public administrator. But like, to me, the novel insight for me was, wow, administration really matters. You know, like I spent so long focused on policy design. Like, what if you increase eligibility from 125% to 170%, and actually, like, when you look at the numbers, like, if you just increased the take-up rate from 70% to 90%, you're going to have probably a bigger impact on that program. So at that level, just at the pure level of kind of the effectiveness of these programs, but also, as I was sort of saying before, I think it really finally hit home to me about, in the US, we've just gone through a 30-year period where people don't trust government. They don't think government can help them. And there's lots of polling data to back that up. And I just sort of started to think, gosh, there's something here that has something to do with that. That you have all these negative micro interactions with government, especially when you really need it. It's one thing when you're irritated at DMV, in the US, this is Department of Motor Vehicles, to get your license. It's a whole nother thing when it's your retirement check that you can't pay your rent or pay your food for, or health insurance for your kid, or it's just a whole nother level when you have those negative interactions when you're really could be hurt very badly, or family could be hurt very badly by that.
Thank you for the presentation. I haven't read the book either, I have to confess, but now I'm interested. I have two questions that you hit on it a little bit there, Pam, about the trust in government. Now, but is that indicative, you're seeing it from a US perspective, but is that more indicative of what you're seeing across the patterns of government in different societies? So if trust is diminishing, are you seeing the same administrative burden challenges? And the second question I had was actually when you talk about cost-benefit analysis and the burdens that are put on individuals and the burdens that are then put on bureaucracy as well to administer programs, is there any sort of aggregate economic sort of impact or assessment that's been done to show how much these intentionally or inadvertent administrative designs really cost a society?
That's a good question. I'll answer the first one, and then maybe Don could take the second one. So I was talking in a very specific US context. It's been really interesting being here for the year, though, because I've seen a range of different examples playing out in a similar way. So the shift here around income support policies and the sort of consolidation of these disability and income support programs, and they're just, all of the media accounts are like another example. We could have spent a whole chapter on it in our book. That effectively, on the one hand, you have these politicians saying, oh, we're trying to make it easier by having this one program that you can all enroll in. And on the ground, people trying to navigate it cannot navigate all these different hurdles, basically, they've put in people's ways. So I think there's variance. So the UK and the US actually have, and Australia to some extent as well, New Zealand less so increasingly, have very sort of similar kind of social welfare policy patterns, with the US, of course, always being a farther outlier than everywhere else. Within Europe, we're starting to do some work in Denmark, for example. You see less of it, to be honest with you, but it's still there. But I think it varies as a function of kind of where you are in the design. And yeah, I think it can vary quite a lot. Do you want to?
In terms of your second question about the estimates, the short answer is no. So you can find out useful statistics, like using those estimates of the amount of time that people spend from filling out forms that's collected via the Paperwork Reduction Act. You can find out it takes people 3.7 billion hours to fill out their tax returns each year, right? And much of that time they're providing information to the federal government that the federal government already has. And so arguably they should be spending a lot less of that time. And you can always assign a dollar value to those hours. The one example I have seen this used in practice is in litigation. And so in litigation about abortion rights, some plaintiffs will actually hire people to try and estimate, here is the amount of dollars and time incurred if this abortion provider closes and I need to seek an abortion, because I've gone from one that was 150 miles away to needing to travel to the next state that's 500 miles away, and so I spend 14 hours in the car and I have to spend X number of dollars in a hotel. So not systematic, but that's an example. I think that's sort of, however, the next area for people to push on. And so right after we published the book, Cass Sunstein wrote a nice review of it. So he's the sort of nudge guy with Richard Thaler. And he just now came out with a paper where he draws a bit on our work, but also on his work with Thaler, and has called for what he terms a sludge audit. So it's the opposite of nudge. It's a sludge audit. But the argument in a nutshell is we should extend cost-benefit analyses to citizen-state interactions, right? And that's basically where we are. A few academics were like, oh, we should really do this, and we should really do this. I mean, someone should pick up the ball and go ahead and do this.
And on the positive side, if governments get better at those interactions, if they do the opposite to administrative burden, if they make all the systems look like the social security system, the seamless system, the automatically done tax form and such like, is there evidence across the world that that makes people love or trust their governments more? Because you depict a kind of the vicious cycle in the United States, which is people have a terrible experience of government, then they hate government even more, then they want less money to be spent by... Is there a positive cycle in this or not really?
So everyone hates government, but maybe they'll hate it less if it doesn't intrude quite so much in their lives. So if you remove some of the negative frictions that you have with government, you have less reason to be angry about it. So I believe that to be true and to be the case, and I haven't done an analysis to verify that claim, but I do think that even if it's not the case, normatively, these are things government should be doing anyway. Government should be thinking about basic design principles so that every time they interact with a citizen, that interaction is done with the least amount of burden imposed upon the citizen as is required by law and as is necessary for the program to function well. I mean, if nothing else, people who are engaged in these sorts of government activities should have that basic principle in mind. Because in general, those of us who study the public sector know that there's maybe a little bit of a tendency for us to externalize costs onto citizens rather than take on some of those costs ourselves.
One of my favorite examples of that is in the Singaporean civil service, where performance bonuses for senior civil servants are awarded on a composite of measures, but one significant part of it is the welfare of the bottom 20%. So what's happened to households in the bottom 20%? And if their lives have improved, your bonus actually improves, which is quite an interesting measure when you think of how heavy administrative burden is on the bottom 20% in most governments. We've got time for one last question or reflection or comment, if anyone has one.
I like your question, Nari, which is how do you write a book and stay together?
There we go. How do you write it? I was told by an eminent British historian once, he said, when your partner reads your manuscript, there's only 5 words, he said, any man wants to hear from his wife, he said, putting it into context. And I said, oh, really? And what are they? He said, darling, you're a genius. And,
That's completely how this works.
So, you know, obviously, as academics, we're trained to take each other's work apart and to find ways to make it better. So, presumably, it's not, darling, you're a genius. How does it work?
Yeah, I mean, I think the nice thing about this was actually that because we'd just done really different stuff before, like we were sort of, even though we both did policy on some level, like just really different things. So this was sort of a nice collaboration. And I would say this because like I collaborate with a lot of people. It's like all of my work is collaborative mostly. And the key with good collaborations is like good paired expertise, basically, so that you get people who, I know more about this than you, and you know more about this than me, and then it becomes actually a lot of fun. Like, especially if you're sort of open to that sort of thing, it becomes a lot of fun because you don't know everything about everything, and you end up with a product that's substantially better than if you just tried to do it on your own, basically. So.
And I think there are some advantages, right? So if you co-author with other people, you often tend to be maybe less honest about the shortcomings of the other person's work because you know there's some level of social nicety that you have to maintain. But if you've spent 15 years together, you can be very honest about the shortcomings of the other person. And there isn't a lot of, you know, you're a genius, my dear, discussions. And if you know, your co-author in Denmark or in Australia hasn't answered their emails in 2 months, you're like, oh, what do I do? If they're in the same house as you, it's a lot easier to track them down and get them on schedule. But you know, generally, I think if you haven't had kids, I don't know what it would be like. But if you've had kids, anything is easier than having kids. Once you've had kids, you can do anything together.
There we go. Well, listen, I want to say from all of us here, but also from the students and faculty of the school, it's been such a pleasure having you at the school this year, Don. And I know Oxford has benefited greatly as well as the school from having you here, Pam. So just a huge thanks for the book, for the scholarship and the intent that lies behind it, and for spending this time with us. So thank you.
Thank you, Mary.